Minnesota visiting my son for Parents Weekend at his college. And so this is why I am not in my office and I'm coming to have my garden background. Next slide. As you all know, most of you are pretty accustomed to this gathering. So we try to mute people upon entry. We do have a lot of conversation. Oh, that's so nice of you to say, Marianne, but he's 21. He's graduating this year. Folks are muted.
Maybe she started when she was 12.
No, I just have my dad's genes. I'm almost 50. So it's just I look at my daddy. And I'm not afraid of saying my
There's
age.
hope. There's hope. You're almost 50. There's hope.
I know. So this call is being recorded. Recording will be available on the Gravity Confluence page following the meeting, and everyone's encouraged to actively participate in the chat. We do try to keep the chat going, so please send chats to everybody. Next slide. This is our common antitrust practices slide. I am not going to say any of it today. I say it every time. Next slide. These are our amazing sponsors. We have a bunch of new sponsors coming in for 2024. And I just want to thank all the sponsors for guiding us through kind of a tight year last year and leaning into the work. And if there ever was an application of why gravity standards are important, it's all of those things Lucy was talking about. There's a lot going on in the social determinants of health, health equity, data standards, policy, measurement space, and gravity solutions are kind of sitting right in the middle of it. Next slide. So this is our agenda for today, announcements, and then going through some project schedule stuff. We are really excited to share with you a resource that it took, honestly, 1.5 years to develop. So we'll be talking about our approach, initial understanding to how you can move from an example of an instrument applying to IQR to ICD-10 and STEM CT diagnoses. And then we're going to talk about these 2 little sprints we have ahead of December holiday time. Next slide. Next slide. We don't have a ton of announcements because we're kind of in a identify new opportunities phase. We're looking forward to that January Connect-a-thon. We really are trying to lean into bringing a team to that Connect-a-thon. One of the things we're thinking about trying to test is the screening use case. And so if you have any ideas about testing elements at the Connect-a-thon, please let us know. We would love to have you centered in that. And then we are grateful for the support of the Lantana team for planning for that Connect-a-thon. So looking forward to January there. And then the social care co-design is just about to sunset. And we have our last session next week, and then really look forward to bringing you all the final report about that. Again, thanks for our friends at Health Begins for facilitating and helping write the report. And it's all funded by funding from RWJ. Next slide. Next slide. So the roadmap is unchanged. Again, right now we're making use of this special little time to try and before we get into the holidays. We saw the amazing kickoff of our friends at the Coding for Food work last time. We already have a Confluence page for that work, so you all can review some of the evidence and slides and everything that was presented in that call. And again, we're in the fundraising phase right now and look forward to hopefully beginning that work in the spring. And then really looking forward to the January Connect-a-thon, and we're in our strategic planning mode with the operating committee and strategic committee identifying additional work to work on within both the technical, pilot, and terminology work streams for 2024. The future works pretty bright. So looks pretty bright, I should say, and works bright too, I guess. Both of those things. Next slide. This is what 2024 is looking like. Again, Coding for Food happening across 2 different sessions. And then there's a lot in the hopper that might be coming onto this roadmap. Just know there's just a host of things. And we, again, are knee deep in that process of prioritizing within our leadership committees and look forward to bringing it to you all ASAP. Next slide. Any questions? And just note how things get onto the roadmap is from all of you, right? So you identifying things collectively. So everything that we're prioritizing is kind of a backlog that's been brewing for a little while. And when we do start to apply it, I don't think there's going to be a ton of surprises. It'll all look like what you've identified in the past as being areas we need to go in. Next slide. All right, next slide. I am so excited. You know you're a nerd, right? So we are super excited. Again, you're getting it hot off the press. The press release hasn't even gone out. I mean, I think it's going to happen shortly, so I won't be putting anything on social media until the press release goes out. But we are really excited to release and show you all the Accountable Health Communities Health-Related Social Needs Diagnostic Resource. This is a page I'm calling the who was involved in it. It was a joint project with our longtime Gravity sponsor and in-kind team member, the American Medical Association. And you know the AMA to be across Gravity. Monique Van Berken's part of terminology and tech. Our technical lead is Corey Smith of the AMA. AMA also offers all kinds of in-kind support through experts like Jim Shalaby and Lloyd McKenzie. So just thank you, AMA. And they had a focus specifically on trying to give IQR support. So this is a first of 2 resources that we're offering. Again, it was crafted at the request of CMS. CMMI reached out to us, and you all have reached out to us in various ways. Asking for like what Gravity's approach to assisting implementers with coding within the IQR domains. And we just want to nod thanks to these women that all donated and volunteered their time. Kathy Gianangelo, Sue Bowman from AHIMA, Tammy Love, Denise Harper of AHA, and Linda Hyde. So we would not be able to do ICD-10-CM work in any way without these wise folks. So thank you again to the AMA, and thank you to the women noted on the note. Next slide. So there's principles. Just because it's Gravity, we don't release something without principles. So when the resource gets disseminated, it has these principles at the top of it, which is that social risks and social needs based on screening assessment instruments always should be verified by a care team member via personal interaction with the individual being screened. We state this to try to make very clear that when we're giving diagnostic suggestions, we don't imagine an automatic process. You have your risks identified with screening, you talk to people, and you assess needs in conversation. And then we also, because of our data principles, always make sure that we identify the risks in any data that we're creating. And that's part of what we've done at Gravity the whole time. So these are on the instrument, the resource. And then next slide.
Sarah?
Yeah.
Thank you for stressing the risks on the previous slide. Why do you say should instead of must? Is this canonical? Is this what we said like 4 years ago?
We can, if you want to suggest that it gets changed to must, I hear you on that. There's going to be versions here. I hear you.
I think at least the first bullet should be a must.
Okay, got it.
Which underlines the personal interaction going on, because we have so many auto things going on now, AI invading daily life in ways that most of us are probably unaware of. So let's, as Gravity, just stress that we believe in personal interaction and say must here. That would be my thought.
And look at Sue saying, our friend from AHIMA saying must. And again, this is the great thing about this is we're releasing other instruments, and the heading slide, the heading elements, the principles will be able to be iterated across different versions. So thank you for that. And we hear you.
Thank you.
It won't be out in this version because this version's already like left the train station, but we will be versioning and it will be updated. Just know that the particular version is already out there, so it might take a little bit to get updated, but we hear you. Next slide.
When you say a little bit to be updated, are we talking months, years, decades?
I think we can edit the principles part without doing too much versioning. Definitely not decades. No. Maybe months. Like not too long.
This year? This year, is that fair?
Because I don't know if, this year is in 2023.
Yeah.
just because there's a process involved, can I just like come back to talk to you about it next meeting so that I can give you a good date? Because I want to give
Okay,
you a promise that I can actually keep. And then, so that means that I have to go back to the like,
thank you.
yes. Yeah. I don't want to say anything that you can't hold me accountable to. So let me,
Hopefully a period we can all feel and that you find realistic. Okay,
exactly. And the first
thanks.
period is I promise to tell you something solid next meeting. That way I'm accountable to that. Next slide. All right, so this is kind of the why, right? So there's a couple different reasons why we did this. Is one, very simply, it provides best suggestions from Gravity on ICD-10-CM and SNOMED CT codes that could issue directly from the domains of the current IQR measure. And it references the AHC Health Related Social Needs instrument because that instrument was the source of the domains in the measure. So that prioritization of domains that they used to CMI used to create the instrument is carried over to the domains of priority in the measure. So we knew that if we leaned into this instrument, it would provide kind of a pathway to applying the same possible codes to other resources. But in addition to just providing those ICD-10-CM and SNOMED CT codes that are kind of direct, like you ask this question, you get this code. Because of centering patient assessment and conversation, it also provides a deeper view of the ICD-10-CM and SNOMED CT codes that can arise from interview and conversation. Because some of the codes are so non-specific that they don't get to subdomains or drivers, and we know that interventions are best directed when you know subdomains and drivers. So we are even kind of showing to the community how conversation, when done well with an understanding of drivers, can create different subtleties in SNOMED CT subtypes or ICD-10-CM subtypes that could then be aligned with interventions. So it's kind of like the first time that we've been able to show the logic of all of the build of SNOMED CT terms and measurable subdomains that you all know because you're here. You know this. Like you all know what we think about when we think about creating subdomains and terms in SNOMED, but the ecosystem does not. So we're really excited about trying to show that to everybody. And I even put a heart there. Next slide. So this is an example, and then we're going to take you directly to the tool. So if you think about the AHC, if we can start the slide, my apologies, just for 1 second. And then we can go, I just want to describe the rationale and then we can go back here. My apologies. Yes, just for a second. So we're going to hyperlink and show you the exact instrument, but you can see what I was mentioning on the previous slide here, because you have what you're able to encode from the question itself. What is your living situation today is the question. And the answer is, I have a place to live, but I'm worried about losing it in the future, which doesn't get you to anything more than an unspecified housing instability finding. But then you can start drilling down into the different subtypes. You can start asking questions about risk of homelessness or homeless in the past 12 months or frequent moves. And these all have different possibilities for SNOMED CT terms and ICD-10-CM terms that can then create interventions. And now we can go into the instrument and we're going to review it together for a few minutes. My apologies, Hamali. So it's posted on the Confluence, and that's why I just have to make sure that all of our versioning is correct, so that we make sure that because we can probably fix the principles part without fixing too much down below, right? But so all the principles we just mentioned and the rationales and the guidance, that's all this first section. And then if you scroll down, you can see we also have the version information of of what versions of the terminologies that we referenced, and then you can see our acknowledgments and thanks of the women that we just mentioned. If you scroll down, and then you can see this is the comprehensive instrument. So it goes domain by domain. So this is the question from the AHC regarding housing instability and its subtypes. And if you keep on scrolling down, you can see the same question with a different answer is unspecified. Is just the homelessness unspecified. And then we break out the answer into subtypes that also have specific like measurable domains. So we have I'm temporarily staying with others is sheltered homelessness, which we know to be what something called couch surfing, not couch surfing. I think is that what it's termed? It's McKinney-Vento homelessness type that teenagers or adolescents are very much at risk with, and the term is suddenly blanking me. But this is what we homelessness living in a shared accommodation is what we named it with SOMED CT and our housing experts. Temporarily staying in a hotel or a shelter is still sheltered, and then living outside in the street, on a beach, in a car, abandoned building, that would be unsheltered homelessness. Oh yes, sorry, Samantha, thank you, doubled up. Whew. It was right there and I couldn't find it. Thank you so much. And if you keep on scrolling down, you can see this is the inadequate housing question from the AHC. And then all the different subtypes of the answer specifications have different IC10-CM codes and some SCT findings. And there's a lot of comments on there because some of these have subtleties with coding. And then you keep on going down. One note regarding food insecurity is because food insecurity is a very highly evolved domain when it comes to measurement. There is some notes regarding the instruments of question because the instruments themselves have specific guidance on outcomes. So I'm just going to see if there's any comments in the chat. I think we can stop. Does the AHC health-related social needs relate to proposed new reimbursement? So specifically this instrument, the reason why CMMI wanted us to lead on this is because this is the kind of anchor instrument for the inpatient quality reporting measure that comes into reporting in January. And so they wanted to be able to offer everyone in the ecosystem Gravity's best diagnostic guidance. It also does have, it is an instrument of reference for the new proposed social determinants of health screening, like G code that's out in the ecosystem for calendar year 2024, if that gets approved. And then it also is one of the instruments it's an instrument referenced in every other CMS initiative, whether it be the CMS health risk assessment guidance they just gave and other guidance. Lucy, did that answer your question?
Yes.
Okay. Mostly just now, it's way too robust to go fully into it, but I just want to thank all of the many people who worked on this. It literally took a year and a half. But the logic and thought that went into this instrument, we hope to now be able to replicate in other instruments because it just took a while to figure out our pace and to get some of these codes into the ecosystem. So have fun downloading and exploring it. Look for an official press release later on. But again, this is kind of the first time that we've been able to share outward of this meeting all of the thought you all help us put into all of our SNOMED CT terms and IC10-CM terms. So we're really excited to see it in use. And it's the kind of thing you could imagine having right on your desk if you have, like for a desk reference. That was kind of our thought, right? As the clinicians, or even on my desktop, is I use algorithms and desk references on a regular basis. And this was kind of the thought with this one.
So,
all right.
Sarah, this is really incredible. All of these codes are new and will be learned, and the subject of training, hopefully, and maybe produce meaningful information.
It is pretty exciting, Lucy. And this is the thing, this is an easy thing to train to. The complexity of everything we create in Gravity is hard to train to for clinicians because it's hard to see a path forward. But so there'll be other instruments that we're going to be producing as well. So we'll be and luckily, again, the logic, like the hunger vital sign is repeated across so many, we won't have to repeat what the work we did there. And many of the questions here came from Prepare. And then, so there's a lot, so we'll start iterating on other instruments again, but yes,
But this isn't a new workflow. This is an incredible refinement of existing workflow, right? Isn't that true? Okay.
It is true. It's a way of getting the codes that we've crafted into patient stories. Like that's kind of how I see it. Like, right. So they're able to be applied to the act of talking with people in ways that make sense.
Terrific. Bravo.
Yeah.
Thanks to everyone that you thanked earlier on, and we didn't necessarily know what was going on yet. So thanks to all of them. It's
pretty exciting. And then there are some other more technical versions of this that will be coming out in the ecosystem as well. But yay, it's very exciting. Okay, now back to our regularly scheduled program. Have fun downloading it from the Confluence. The link is live. There's also it's gonna be in a section of the Confluence that actually is to assist implementers with coding. So they're in documentation of findings. And so the OMH resource we presented last week will be there, prepared as its own brilliant mapping of its instrument. So we hope to work with NAC to get that here as well. And so you'll be seeing more tools blooming here as we build more. All right, now back to our slides. All right, again, thanks. It's pretty exciting. Next slide. So there's a couple caveats in here because we're calling this identification, but we're not a new code build. Yes, we do, Marianne, that's true. We have good friends over at Epic. So now that this is done, I hope to disseminate it wide and far. I'm going to try to wait for the press release to get out because it took a little bit, but it's pretty exciting. What I wanted to say here is that we're not actually identifying new terms. We're actually just leveraging terms that we've created in the past in this little mini sprint. So it's not actually identification. It's like process and regrouping. Next slide. That's why I put these little cloud bubbles. So usually we're identifying new codes, right? But we're not going to be analyzing gaps really. We might be thinking about them, but our build happens for utility and security in the spring. And we're only building value sets. We're not building new terms right now. Just want everyone to be aware that this is a unique moment in time, really because of this opportunity and because the drivers we have all over the ecosystem. Next slide. So your primary job, your homework is very simple. It's to help us make sure we get the emerging utility and security value set right and to be engaged members of the collective as we discuss a few other things over the course of our next weeks. The biggest thing to take away from here is, as of Friday evening, per usual, the master list that we've created for utility and security, focusing on the concepts you'll see very shortly, will be available at 5 for your review and download. And we are not meeting again for 3 weeks because of our cadence shift in order to allow collaboration with HL7 vocab. If you go to the next slide, I say it all over again. Everyone, not in 2 weeks, in 3 weeks, in order to have the cadence with HL7 vocab, because we want to go to their meetings, they want to come to our meetings, and we just never have allowed that, and that was silly, so we're trying to fix it. Next slide. Okay, IQR enhancements. Here we go. Next slide. And again, I got my date. I think I fixed my dates this time. So again, the moment in time that we're trying to lean into, and there's actually a few different drivers here, not just IQR, but that the inpatient quality reporting, inpatient prospective payment servant screening for social drivers of health measures and screen positive measure comes into reporting in January. We have heard loud and clear that you all want to help us help implementers align with gravity standards when that reporting comes into play. The AHC instrument is a good example of us trying to assist implementers with our codes in practice. And then we, if you look at the domains, we said this last time, but it's the end of the coding for food stuff. If you look at the social drivers of health measure, it covers a lot of measures we've done thoroughly, right? But a couple that we have not done yet or did not do specifically, right? Utility and difficulties and interpersonal safety are the opportunities there, because we have very full, robust approaches to all of the others. Next slide. Just making sure. Oh, so financial instability. We did that in 2021. In fact, our work on utility and security is based on that. And I'll talk about that in a little bit. So the opportunities.
I meant the coding, Sarah. Is there coding comparable to what you just showed?
Yeah.
If you go back, there is. Okay.
Yeah. So once we have that instrument that I showed you, right? So that we just talked about. So now that we have a template, like there aren't a ton of just general financial insecurity questions, like the CARDIA is kind of the gold standard. But absolutely, we have pathways to assisting implementers with the codes we imagined when we crafted those terms.
So this third bullet, that's why I asked the question. It talks about food, housing, transportation, utility, and interpersonal coming up. So is financial instability
I didn't understand. No. So for the IQR measure, these are the domains of reference. Those are the ones that a CMS is focusing on. There's no because generally financial instability is a loose, unspecified bucket that many of these things fit into. And in fact, we're talking about financial insecurity in just a few seconds, and I think that'll help. We're going to rewind to 2021 in order to talk about utility insecurity in a few minutes. And it actually talks
Okay.
about financial insecurity. Very, very fortunately. Next slide. So we're leaning into the utility insecurity value sets, which are abstracted, Lucy, from previous domains of financial insecurity, which we will soon redefine for you in material hardship. And then guidance for aligning interpersonal safety screening with the evidence, right? And we'll talk more about both of these things in the next slides. Next slide. Utility and security value sets. Next slide. Right, so Gravity's going to be working on utility and security terms into a master list. This is what posts tomorrow at 5 o'clock. Full insecurity, new terminology build is spring 2024. Level setting, utility and security value sets are based on the work we did in 2021 on financial insecurity and material hardship. At that time, we crafted lines in the sand with our housing experts, our material hardship experts, and our financial insecurity experts regarding the relationship between inadequate housing and utilities. And we're not going to change anything right now. We do not have time to enter a full consensus process, and we do not have our subject matter experts with us completely until the spring. Hi, Janice. Yes.
I have a quick question. Where I am, I know that when we discuss this, we actually include our broadband into utility.
Yes.
So, yeah, are you going to do that?
No, because we're
Oh.
following the CMS definition. We just did
Okay.
digital access and digital literacy as its own thing.
Right, I know that. But
Yeah.
as a rule, we try to include it. But yeah, I got it.
Well,
I would have a caveat regarding it because it is so important today where so many are really requiring like that you have to have even now like a QR code and stuff, and we're only
Yeah.
going electronic, right? And so it's just something to mention to them because it seems like it should be a companion.
Oh, you mean like to CMS for the
Right.
measure? Okay, yeah. So with my other Sarah De Silvi hat on, because I'm the lead of the revision of the measure.
Okay.
I can mention it to CMS.
Yeah, I mean, just as a caveat, it's very
Yeah.
important because
Yeah.
and they're going to recognize it right away too. And
Yeah,
I've included it like in my area for like 5-6 years, and nobody's doubted me, like on tax.
No, I know. Yes, I hear you. So for right now, though, we are following the letter of the law because that all we're doing is and again, we'll talk more about this when we get into the spring full build.
Water, heat, and all that, right? Gas.
Yeah, water, heat, electricity.
Right.
Heating and cooling, water supply, electricity are the three fundamental ones.
Well,
But
good. Okay.
we do recognize digital access as important in digital because we just addressed it as a domain, but for the measure, it's those elements we're leaning into. And connectivity was across the spectrum of financial insecurity, material hardship, and we'll talk more about that in a second.
More environment.
Yes. Next slide. Oh, thank you. Jonathan's dropping links. And so, Lucy, this is for you, right? We were just talking about this. So I'm reminding us what this is the end result of our work that we did with financial insecurity, material hardship in 2021. So financial insecurity, material hardship are a spectrum where financial insecurity is worry or difficulty paying, and material hardship is not having it, right? And so those are the two domains that formed these buckets. And what we knew then in 2021 is that as we pulled out domains to specify, these buckets would get smaller and smaller. So what is in there, what is in material hardship will get more and more constrained, because if you pull out digital access and you pull out, right now we're pulling out utilities, the bucket gets smaller and smaller.
Well, I would just suggest, Sarah, that financial insecurity and material hardship are the beginning of discussion of financial inequity. And
Yes.
so we don't want this to disappear into buckets of things that we can identify that if people had, they would be better off.
Correct. It would never disappear. Yeah.
Okay.
I wouldn't. That's not. And the great thing, the truth is that a general, are you having a hard time paying for? I mean, like the cardio screen I just mentioned that I thought you were talking about is a great one-hit wonder, right?
Okay.
You're trying to figure out one question that has the power to determine whether you need to ask further questions. It's a really good one, right? So
Thank you.
intention of making it go away. It's more that some of the things that were in the bucket are getting specified.
Thank you.
Next slide. All right, so this is just reminding us of the spectrum of financially driven insecurities, and this is a slide we show off on a regular basis, right? So the spectrum of insecurities runs from worry to cultural acceptability, and cultural acceptability is one that's not always applied to every domain, but in food, we're very, very careful to place that because it can directly, what you have resources to purchase can directly affect your ability to follow cultural preferences and food choices. And then we talked about applying that. This is the slide we've seen before to food insecurity measurement. So food insecurity measurement currently does everything but cultural acceptability, and there's questions emerging in the literature about how to do the last one. When it comes down to utility insecurity, again, we're not making anything new right now. We're going to be new work in the spring, but we're finding relevant utility insecurity elements within financial insecurity and within material hardship, because that's the spectrum. Like, I'm worried about not paying my bills and I can't pay my bills and my power's cut off, right? So this is where knowing the spectrum of the insecurity is where we're finding our utility insecurity terms in our sets. Does this make sense? This is a slide you've seen a million times probably. All right, so it makes sense. I'm going to keep on going on. Next slide. So the Gravity teams performed an initial assessment of face validity terms across existing value sets and gathered them into a master. Remember, just for all of you, utilities were a key focus when we did the work on financial insecurity and material hardship. We thought about utilities very deeply when we built our program terms and our screening instrument selection. So there's a lot there. And then we're going to do a quick ask of our SMEs to review it, and then we're asking all of you to review it. And just note, looking forward, again, nothing new being built now, but when we think about opportunities for new terms, there's a lot of opportunities to better represent difficulty paying for, because we pretty well represented cut off material hardship. Great. And then, but we only address kind of non-specific financial strain and financial insecurity. So we really we will likely have to lean in as a collective and filling in that difficulty paying for. And just a note, as a clinician, that's where I lean in like multiple times a day. You know, signing a note that you can't turn off my patient's power because they have a nebulizer, or and putting their power off will threaten their asthma or COPD, right? So that intervention is something not turned off yet, at risk of being turned off because they're behind on payments. And clinically, I cannot count the number of times I write letters to prevent and stay cutoffs in my clinical day. Janice?
Yeah, I just want to add, I've been involved with, charity giving organizations for over a decade, one that I helped to start. And I just know, talking to the leaders of the other organizations, utility is the main thing, the last thing that people will pay for, right? I mean, the rent is always first, food, whatever, transportation is maybe like third sometimes. But utility bills tend to, even if they're receiving a benefit or LEHEAP, a discount program benefit, it still adds up. And usually they don't come for help until they have like thousands of dollars owed. And so that's when it ends up getting cut off. But it's very real, like what you mentioned. So I'm sure this is why CMS has brought it up, but some of you might not know that this is the main thing that people go for assistance for, like after housing.
It is, yeah. And I think personally, I remember when I was in grad school, I used to joke with my friends that I was like a jungle bird because I would only pay things when they turned red. Because I had no bandwidth, I had no money. So unless the bill was red, it did not even register. Right. And it was because in the press of everything, I just want to know that that's my own story. It had to be bright and red and shiny for me to even think it was important in the press of everything. Next slide. All right, I think, Hamali, can we move to the next slide, or is she with us? What about utilities that are inadequate? So just the good. So Teresa, that's really important. So just as a note, this is actually very apropos. So when the equipment in the house is not functioning, as opposed to I can't pay the utility, that's when it falls into inadequate housing based on our past work with HUD and material hardship folks and financial insecurity folks. That might not remain the case when we do utility insecurity deeply in the spring, but that's the lane we're in right now. And you can see I'm about to comment on this in a couple seconds. So that's the way it's been. Like, is your stove working is an inadequate housing question, and part of the American Housing Survey. Can you pay the gas for your stove is a utility question. Does that make sense? Okay, I'll try. So I note this here that we're going to try to have to figure out what to do in the spring with the CDC Z59.12 inadequate housing utilities code. We did not author that because of just what I just mentioned. So back in the day, our SMEs separate inadequate housing from utilities, but this term is in the ecosystem. It can possibly represent the most extreme, like not like cut off and not working utility insecurity, but it's not likely going to be able to represent I'm having a hard time paying. So we'll have some things to think about in the spring, and we're not going to adjust them now, but I want to make sure you all are aware of what we are seeing when we're doing our master and what you're going to be seeing on the master over the next weeks. Next slide. And just note that we have a couple SMEs already pegged for the spring, and we are interviewing and talking with a couple more. I do want to note that the person on the right, Dr. Deborah Frank, is my hero. She's why I got into this work. So the idea, and then Stephanie is one of my best friends. This is totally apropos. We were connected to them independently, but just wait to meet Dr. Deborah Frank. She's been working in this ecosystem forever, and she is a powerhouse. It's going to be exciting. They're amazing. I know. Like, I'm so excited. It's going to be great. And then we're having some more interviews getting ready for the spring. Next slide. All right, so these are the early assessment instruments. You're going to see them again on the master when it's posted at 5 tomorrow. Next slide. So we have the AFP tool, the American Housing Survey, BMC Thrive, Children's Health Watch, the Cowlitz instrument, Health Leads, Prepare, Health Steps, AHC Health Related Social Needs instrument, Total Health Quick Check, We Care, WellRx, and your current life situation. So it's exciting. So these are all the instruments that we've gleaned again from our previous work. Hi, Julian. We were just touching on this earlier. Next slide. And then just some examples of the questions. So in the past 12 months, has electric, gas, oil, or water connected to threatened to shut off service in your homes? A company threatened to shut off service in your home. So that's that threat, right? So not actually off is one already shut off can be one of the answers depending on the instance of this question. But yes and no is sometimes the answer. So if it's just yes and no, you wouldn't get the already shut off, obviously. Next slide.
Sarah, I asked in the chat about sewage. Is sewage generally included within the water bill? I really have no idea.
It depends on the municipality.
So should sewage, go back to the previous slide, should gravity introduce the idea to be accepted in another 10 years? Previous slide, that sewage needs to be, I'm sorry, there was a list of, no, go back to where we were. Anyway, there was a list of things included in the concept of utility, and sewage wasn't there. That's why I'm asking about this. There, thank you. Electric, gas, oil, or water company. Where does sewage fit here? Does it fit?
Usually with water, except if you have a septic tank. I don't know if always, yeah.
I also would like, personally in my city, it's part of taxes. It's not part of utilities. Like I don't pay a sewage bill. It's part of my taxes.
Somebody just got a $600 sewage bill at an apartment building near where I live.
No, so that does happen. I know. So I think we can hold space for it, but again, for I
Yeah,
think we
please hold
Yeah.
space. We're not going to solve this now, but just hold space, because I mentioned in the chat that there's just been a huge victory in Alabama about having to do something about sewage where there has never been sewage disposal.
And this does interrelate to some of the environmental domains that we're thinking about, right?
Oh, absolutely. Yes.
And yeah, so I think it's really important to note this. And again, this is the great thing about things that go on our backlog. There might have been a pause, but usually we can find friends to help us get address things, right? It might
Thank
be a
you.
different domain, but we hear you. Next slide. So these are questions from the American Housing Survey. I'm not going to go through and read them, but they're really lovely questions about utility assessment as part of the American Housing Survey, as authored by HUD.
There it is, garbage, water and sewer. Okay. Hooray.
Hooray. Next slide. And again, we will discuss the boundaries of utility and security different than how we have in the past in the spring. So we can bring it back up and have Stephanie and Deb, Dr. Frank, help us with that one. And then we have do you have trouble paying your electricity bill from BMC Thrive, and then Children's Health Watch screeners they use in all of their research. Next slide. And then there's the Cowlitz tool, and then there's Health Leads. And then next slide. We have Health Steps and Prepare, of course. So this is the Prepare question 14, which has so many elements in it. Next slide. And then there's AHC and Total Health Quick Check. Next slide. And then We Care and WellRx. These are all friends, right? We know these instruments. We're just assessing them for utilities, but we know these instruments well. Next slide. And then here's your current list 5 situation. All right, I think that's it. Next slide. Yeah, so when you open up the master tomorrow, again, the idea is to look at all those instruments and just help us make sure that we're on the right target. Again, these are all instruments we've gleaned from past work. And now we're going to go into professions and programs and roles. Next slide. And so we have, again, you can see how we tried to lean into utilities and material hardship, right? So we have utility assistance programs. We always try to refer to those places that can help people with many things. So we have the VA, state assistance, TANF. Of course, there's low-income home energy assistance program, ever so critical. We have to figure out what to do with telephones, because telephones were not part of digital access and are sometimes part of utilities. And so for right now, they're in, right? So again, we'll think about that more when we come to the spring, because digital access did not include phone service unless it was actually, just plain like landline. So we have to think about that. Next slide. And then these are all of our core comprehensive ones that go across all of our domains, like community resource assistance, benefit enrollment assistance program. Julian, there it is. That's the name. Community action agencies, legal aid, etc. Next slide. And then all of these, again, are on the master. So we look forward to having you review the master and email us comments as you usually do, just to make sure we can have a reflective. And right now, it's just like, if it's okay, then we want to leave it because it's already encoded in the ecosystem. It's already in a value set. But if something seems to be off, just please let us know. Again, the idea is implementers are out there trying to do this on their own right now. And when that's not great because there's no standard. So we're trying to give them a glide path. Next slide. Now, if we have time, I know we're close to the top of the hour. I'd love to we're going to keep on going and talk about, we've presented this as a high level. Is everyone ready to switch brains and talk about interpersonal safety? To switch? Any utility and security questions before we move on? Mostly just download the master and let us know what you think. And we'll come back in 2 weeks. And in 2 weeks, I also owe you an update question. I have not lost track of that, Lucy. So I'm going to think about versioning. I have homework. All right, so we're going to move on to interpersonal safety. And again, sorry, this is just Sarah talking a lot today. Last time it was Sarah not talking very much because of our friends from Coding for Food. Today it's like lots of Sarah. Next slide. All right, so the problem statement with interpersonal safety is a little different. Right. So it's not that there doesn't exist a value set. It's just that our value sets that we offer within this meta domain are specific. So the current IQR measure focuses on the domain of interpersonal safety that aligns with the AHC Health Related Social Needs Instrument and many different statements and quality measures and drivers across the ecosystem. But when Gravity addressed this domain, this bucket domain of interpersonal safety, our SMEs very clearly, very distinctly, guided by the evidence, just said there was no way to consider interpersonal safety as a meta bucket because all of the subtypes were so distinct and needed to be thought of independently. And there were evidence-based instruments that were unique to each of the subdomains. And so we had to go down that path. And we presented that to you 2 years ago. So we focused on that time on elder abuse and intimate partner violence, right? So we did not weigh into child abuse. And we really focused into the literature on the two on adult, very specific types of interpersonal safety subtypes. And you all remember that, where there was a lot of cross knowledge across those two domains, but you all probably remember that, and that's it's been our kind of, you know, guide up until this point. So that, however, leaves Gravity not offering clear guidance to support current measures that focus on intimate partner violence. I mean, so on interpersonal safety. Oh, I know, they're coming back. Lucy, just you wait. I haven't got in touch with all of them, but I know that one of them is definitely coming back. Next slide. So one thing also of note, that in addition to the IQR measure, there's the NCQA Health Equity Accreditation plus interpersonal safety requirement. We are reaching out and have reached out already to our NCQA friends about this. We work very closely with NCQA on lots of different things. If you remember, a friend from NCQA was Dr. Adriana Neva was one of our SMEs for digital access. So we're going to make sure whatever solutions we have can align with that guidance as well. Next slide. So what we are leaning into is how we can offer solutions to support the current problem statement or like situation without deviating from what we know from the evidence. So we are reconvening our SMEs, and we thank our SMEs that they are willing to come back in because they recognize how important this is. And there are a couple opportunities for us to offer guidance. So number one, the easy button is we can consider, and again, this is just a work in progress, and they will offer these, they will review possible solutions with all of us, and then we'll create some kind of process together that we all agree on. But one way to make sure that it's aligned with the evidence is to prep any interpersonal safety screening with the CUES model, and we'll talk more about that in a second. And then if we also can follow any general interpersonal safety screening with questions that allow us to drill down into different subtypes. Because part of the problem with the current instrument, the instruments as implemented, which just ask about interpersonal safety, is they don't allow you to get to anything specific unless you ask more questions. And that's where our value sets come in. So we can lean into that problem and offer the good preparation and the good questions afterwards, and then hopefully have a solutions implementers can use. Right now, IQR is an adult measure, so we still are not going into the child abuse element. We have worked very closely with AAP in the past, and there are a lot of, if we do that work, it would be in partnership with the American Academy of Pediatrics. Next slide. So just a reminder of what CUES is, right? If you remember doing elder abuse and intimate partner violence, this is the CUES model. So Lucy, no one's doing it right now, and so we communicate very, very regularly with American Academy of Pediatrics and ACEs folks and the CDC on things in the roadmap. And child abuse has been on our backlog for a while, so everyone knows it's not being done. And if it's going to be done, I don't think anyone's looking at anything else than us. So it would be one of the things we imagined in the past doing is coupling it with ACEs screening, because it's kind of appropriate as a couplet there. And again, that's in our backlog for consideration for future work. So this is the CUES process, which again, it's very evidence-based because it sets a situation of safety that actually encourages people to respond with honesty, right? So what we know from the literature is if you don't do this, then people do not tell you they are at risk. This is across the evidence of interpersonal safety, of intimate partner violence and elder abuse. So, and we have a LOINC submission in process to encode this in standards to apply and be built as part of our standards. And it's establishing confidentiality, universal education. So you don't wait for a person to screen positive. You just say, regardless of whether you screen positive, these are resources you might find helpful if you're in a situation where any of these things are happening to you. And so that means they can say, no, nothing's happening to them and still get help, because they might not be safe enough to say something's happening. So there's all kinds of reasons why universal education is really important. And then really codifying how to support. So what we know we might be able to do with interpersonal safety is say, in order to align with the gravity process, you do this first, right? And this in no way is going to directly affect the instruments you're choosing, but it's the correct lead. They do have pamphlets in restrooms where I receive care, and we use my clinic too. We use different colored pens. But the universal education thing is very, very important. So thank you for reiterating that, Janice, and all the places we put universal education so people can take it in privacy, right? All right, next slide. Oh, Lucy, that is something, maybe when we get Lisa back, she can help us talk about that. I've heard some pretty interesting things regarding all kinds of like emerging concerns with privacy and consent and rulemaking. And then these are possible follow-up questions that again could help guide you to lead you to our value sets, again, to assist implementers. So if you prepare with cues and you ask these non-specific interpersonal safety questions, you could follow up with age of the survivor, whether they're a member of a vulnerable population, and that could tell you whether they qualify for an elder abuse screening or other. Questions about the perpetrator, which includes whether they're an intimate partner, an interested relationship. Intimate partner would point you to intimate partner violence. Trusted relationship points you to elder abuse, if you remember that. And then also questions inquiring about further elements of specific abuse types, because most interpersonal violence screeners don't contain, interpersonal safety screeners don't contain the breadth of subdomains that are included in elder abuse, because most focus on physical, sexual, and emotional abuse. But elder abuse also includes neglect and exploitation. So for elder abuse, what we might come up with is that you actually should be applying an additional screening instrument, one of the ones we validated with elder abuse, right? So these are just the possible things we've been talking about with SMEs, because we could wrap the current questions as implemented with IQR with the general questions, with cues, and with other specific questions to follow up that could then take people to our value sets or unspecified terms. Does that make sense? Like just as and we'll get more into it as we go forward.
Is financial included in physical or emotional, financial elder?
Oh, that's exploitation. So there's, I think, financial. I should have put financial exploitation there. My apologies. Yeah, so it's included not in physical. It's in the last term. I'll update it on the next slide, on the future slides.
And I think, Sarah, are you more focused on the word financial abuse, that financial exploitation fell elsewhere, or does financial, that distinction, I think that financial exploitation is not abuse for elders?
No, but there is a financial exploitation and there's financial
abuse.
There's different subtypes. Yeah.
Yeah. Okay.
My apologies for not, I should have caught that on the slide. I'm so sorry. But yes, so Janice, that financial abuse, financial concerns are a part of elder abuse, and it is a part that is not currently covered by most screeners for interpersonal safety.
Wow.
So that's where we can imagine having to get cascade to ask further questions. Does that make sense?
Thank you.
And the interesting thing about that is, even though most interpersonal safety questions don't include it, and most interpersonal safety questions are based off of intimate partner violence, we do know from the literature of intimate partner violence that financial control is a key facet of the power and control elements that are happening in those kinds of relationships, but it's not on most of the screeners.
And most of the people, I mean, a lot of people don't want to talk about it. They don't mention it unless you bring it up often.
Yeah. So that's why the cues model is so important, right? So regardless, confidentiality and universal education, and then even if they don't say they're in a setting that's concerning in that moment, they have what they need to get help. Any other questions? And again, sorry about the missing the financial element. Any other, I see things in the chat. I'm careful not to wade too much into consent solutions because we it's a big sticky wicket, but it's a really good comment. I'm not going to comment on the chat because it's huge. Gravity always acknowledges that it's huge. All right. Any other questions regarding how we can see these two elements helping the cues model prepping and these really clear questions that align with the literature afterwards as being as a way to kind of direct to our evidence-based value sets from the general interpersonal safety bucket. Are we good there? Okay, next slide. I think we're almost done. These are LW SMEs. You might remember them, all these brilliant, smart folks. So we do have a couple of them lined up to help us again. These are all the folks that helped us many years ago. Next slide. And then these are our two, Lucy, these are our two IPV subject matter experts. Chris is no longer at Fenway, but we are trying to reach out to them. And then Lisa James was from Futures Without Violence. Wonderful folk. It was a really just lovely build. It was an extended build too, but next slide. I think that's it. We did it. So in general, your job is to review the master and make sure we got it right. I have a couple jobs. I need to bring back a version timeline that includes the must element as opposed to the should, and considering that with the authors of the instrument. I also need to update the elder view slide to more clearly talk about the financial component. Any questions before we close, friends? I hope this feels like a good way to spend our short period of time. Any questions before we go? We appreciate you. Again, not in 2 weeks, in 3, right? We will reconvene here in 3 weeks in order to match the HL7 vocab meeting. So thankful for all of you. And we look forward to seeing you in 3 weeks. I'm hoping to bring back some SMEs with us when we come back and some direction for the interpersonal violence elements. Have a good day.
Great. Thanks. Take care.